More than 400,000 people have died from COVID-19 in the United States, and with demand for the coronavirus vaccine outstripping supply, there is little for the American people to be hopeful for.
The honest truth is this: things will get worse before they get better. I told you I'll always level with you.
Despite only starting a vaccination rollout in mid-December, President Trump promised the US would vaccinate 20 million Americans by the end of 2020. It didn't get to 5 million. The country has instead vaccinated 11 million people. That's about 3% of the population who've so far received one of the two vaccines. Even less, 1.6 million people have received the 2 required doses.
We were a little concerned and we couldn't wait to get the shot. When we were told we could get them, we were very happy.
President-elect Biden has promised 100 million doses injected during his first 100 days in office. To achieve that, he'll push for the creation of new community vaccination centers and mobilize additional healthcare workers. The Trump administration opted to leave much of the planning and coordination to state and local governments, which were already hammered by the pandemic. And while states have been calling on Congress for months to provide more support, federal lawmakers only last week approved the billions necessary for vaccination efforts, money that could take weeks longer to disseminate. By leaving the guidelines in the hands of each state, state and local workers and politicians are then tweaking strategies to federal health directives, such as redefining priority cases and rollout phases. Some US health experts have argued this extra involvement is bogging down the rollout and that the government should worry less about complex measures and more about actually vaccinating people.
Politicizing vaccines and other control measures is not just unhelpful, but it could fuel the virus and cost lives.
Some states like New York and California have moved in this direction with a simpler rollout strategy of letting all people 65 and older have access to the vaccine.
These 12-hour shifts, these co-workers, this environment gives me the drive and the energy to fight another day.